Officer Tom, I don't want to use your last name. So you are a police officer and you were involved in a crash.
Yes.
About year, 2009.
December 29, 2009.
And that resulted in a lot of pain in your back and the leg as well as hands. And basically here we are trying to, you've been to several specialists, multiple specialists.
Yes.
So basically, this almost a ream of paper, 300 pages at least of all your medical records. I just want to show that you've been to multiple specialists and many treatments have been given to you, and you still have significant pain.
Yes.
Is that true?
Yes.
Okay, so what we're going to do is we're going to just do a brief clinical exam where you're going to, where we're going to, show the type of, functional impairment that happens when you try to do some work, and also we're going to give you some clinical exam in the next 1 or 2 minutes to show how difficult it is to perform all these, activities, and then we're going to give you the laser treatment and then see if there's a big difference.
Okay.
Okay, so, all right, why don't you stand up from your, try to get up from your chair. So getting up is a difficulty, trying to raise from the chair.
Yeah.
Is that correct?
Mm-hmm.
And then tell me, you have your leg pain when you try to do that? Does your leg hurt when you try to get up from there like that?
It hurts in my back and kind of radiates down.
Okay, turn around. Okay, so the low back is pretty sore, so I don't even want to, touch hard.
Right.
And trying to go back, is that how much you can go? So it starts to hurt there?
Starts hurting.
Okay, and then it hurts there too. So you're simply flinching even slightly, so I'm just going to, so you're going to, both these joints here, the middle back, you also have significant, see that hip joint and here too.
Yes.
Anything on the left side?
No.
No. And what about here on the left?
No.
No, okay. And then your knees are okay, but you have some, kind of shin area that is sore?
There's a nerve damage in the shin, and that sprained the ankle, so there's pain in the ankle somewhere.
So why don't you sit down? Okay. So do you have any pain here in an area of the shin that you're complaining about?
Right in here.
Right in there. So if I touch hard, does it hurt?
It hurts.
It hurts.
Yeah.
So obviously this might be a place of confusion where when you got that impact, what happened, or did it come later? Any ankle pain right now?
Yeah, about right here.
You have that right there?
Kind of deep.
Okay. So we're going to treat all the areas: your low back, your hip, and this particular area here, and also the ankle. So the advantage is you're going to get total pain relief after this treatment.
In both hands.
And your fingers, and your thumb, sorry, I forgot this, And all right, and we'll see how that goes.
Okay.
All right, Officer Tom, you just got some, laser treatments.
Yes, I
As we
did.
can see, we probably, a lot of points here that, we did the laser, so totally about 140 seconds, or roughly about 2 minutes and 20 seconds. Anyway, that compared to the total number of records you got there, let's see how you feel. How's your back pain now?
It's almost all gone.
Almost all gone?
Yes.
Okay. And we also treated the ankle and your shin and the thumb as well as shoulder. Before we go on there, why don't you show us how you can get up from the chair?
Okay.
There you go. Very good. You feel, yeah. Why don't you walk a few steps to the front? Very good. And then turn to the side here. And let's do this backward bending. A little bit to the side like that, Okay, now bend all the way back. Look at that.
Wow.
You are not even able to bend all the way back. So this is really fantastic. Improvement in function. All right, good. Why don't you sit down? This is the immediate improvement. Then how does your thumb feel?
The thumbs are a lot better.
Lot better.
A lot better.
You have some deep pain there,
Still some deep pain in this one.
but it's a lot better than what it was. And how does your ankle feel?
I don't feel the ankle pain.
You don't feel the ankle
when
pain?
I'm moving it.
Okay, good. And then you have a little bit of soreness here, and then, how does it feel when I touch now?
I'm
not feeling any pain at all?
I'm not feeling the nerve pain.
No pain at all. Fantastic. All right, so we'll keep our fingers crossed, and we'll see you in a follow-up visit for about 3 weeks from now,
Okay.
and then we'll see how your improvement is. So Tom, so this is about 3 weeks since we did our laser treatments.
Yes.
Okay, and how does your back feel?
Well, the back, the center part of the back is, I would say, almost all the pain is gone.
All the pain is gone. And then what about your thumbs? That was really.
I think more of the severe pain that I was having was more on the front palm area, and that's mostly subsided.
Mostly subsided.
I still have some back this way.
Okay.
Both sides.
Okay. So if I were to give a percentage for your back pain, how many percent are you better?
The direct back area, I'd say 95 or better percent.
95 better, and this one?
65%.
65% better. After the laser treatments last time, some of the activities that you did.
Oh, after the treatment, I left on vacation and went out to Utah, and we climbed mountains.
You climbed mountains, okay.
On several occasions.
Several occasions, okay.
Went spelunking through some big cave, national park. Went whitewater rafting.
Whitewater rafting.
And we went not canoeing, but kayaking.
Wow. So all these things, even normal people might get some pain. How did you do with this?
Well, I noticed the fact that I haven't been active for the last 20 months, so the muscles in my legs certainly hurt, but as far as the back pain, which, like I said, has pretty much gone away, didn't slow me down.
Okay.
And I did notice from the paddling, because I was
using
I'm very cautious, like when I go in to shake somebody's hand, because the front had always hurt really bad, and of course then with the paddling, that's the part that, so I was kind of nervous and tender with that, but I did not have a negative effect.
So, with all these activities, like at 2 weeks time, you were like 95% or plus better with your back,
Yes.
And then the thumb was 65% better. So it really, shows the ability of this laser, treatments. Now, why don't you stand? Let's do this just again. So again, getting up is pretty easy.
Pretty easy.
And then, turn around on the side. Can you bend back all the way? Okay, that's pretty good. Very impressive. And try to get up from your chair. So getting up is a difficulty. Trying to raise.
Okay.
There you go. Very good. Trying to go back, is that how much you can go? So it starts to hurt there. Bending. A little bit to the side like that. Okay, now bend all the way back. Look at that.
Wow.
You are not even able to bend all the way back. So this is really fantastic. Why don't you stand? Let's do this just again. So again, getting up is pretty easy.
Pretty easy.
And then, turn around on the side. Can you bend back all the way? Okay, that's pretty good. Very impressive.